Hello and welcome to the Happy, Healthy, Strong podcast. This is a podcast dedicated to helping you live a happier, healthier, and stronger life. Building a life that you love starts with you owning your health and intentionally creating the best version of yourself. So if you're looking to better understand how proper nutrition, daily movement, mindset work, and strength training can help you create a life full of happiness and health, then you are in the right place. I generally hope that the tips, tricks, and information that we share will be the catalyst for change. I'm your host, Adam Lane. It's time to dive in. Ladies and gentlemen, welcome back to another episode of the Happy, Healthy, Strong podcast with special guest slash original host
slash
OG host of the Happy, Healthy, Strong podcast.
Used to be me on that intro.
It was.
Recorded over.
Yes.
But my words remain.
So they do. I'm glad you remember that. Lauren Hyser, ladies and gentlemen.
Hello.
Yay.
Hello. Where's the applause button?
Yes.
You don't use those anymore?
I don't know which button it is.
Oh,
here.
let's not try.
We could guess.
Okay.
Nope.
I like it.
Nope.
All right. People are going to leave.
And we're done. Ladies and gentlemen, here we go. Welcome back, Lauren.
Thank you.
Listeners, if you're new here, and I have a funny story to go into this.
Oh, this is exciting.
Lauren started this podcast back pre-COVID?
Oh, was it? Gosh. I remember.
Or around COVID.
I think it was around. I remember the videos. I think weren't we making the videos for COVID before the podcast? I
can't remember.
I can't either.
We're 100.
Look this up.
140 some odd episodes in now, which is a fair amount of podcasts that
good content.
We're in here. I don't think it was post or pre-COVID. I think it was post-COVID.
I agree. Yeah.
That sounds right. But then then Lauren left me with a podcast, and
okay.
So we're going to catch up here. But before we do, I tell you, a buddy of mine from church, and Mark will listen to this. He's like, "Yeah, I started listening to your podcast," and literally he went back to the beginning and started listening
as one should,
going back for which is funny, and that's Lauren. That's part of the reason why I'm excited to have conversations with you.
Yeah.
Because, not for the most part, my foundational beliefs of strength and fitness and health and whatnot have really not changed. Now, little things within that have changed a little bit,
sure.
like, especially like 32 Adam versus 46-year-old Adam. Like,
is that how old you are?
Yeah.
No.
Yeah.
Oh, wow.
I know.
I'm shook.
Yes. This is why I can't remember things.
Okay. I mean, I guess. Yeah.
What was I talking about? Bring that conversation back. Oh yeah, that's what it was.
Yeah. All right. That's
makes coffee. That's what it was. I couldn't remember.
We don't distract you a lot today. All right, go ahead.
I know, seriously. No, but it's funny. Mark started to listen all the way through. Yeah. And it's interesting. And then he stopped, and then he went to the more recent ones.
Oh, he got bored when I left,
which are probably good. Well, and it was back in the day he was listening. I forgot what episode he was listening to, but he's like, yeah, there's there was COVID talk and stuff like that, and how we feel that there's a better approach to handle this. And, maybe we need to work on being happy, healthy, and strong and getting outside and, sunlight and, having community with people and, eating good food and taking care of our bodies, not just hunkering down with masks and, praying that the, COVID doesn't come at me. So, anyway, it was just funny that's where he started. So Mark has heard a lot of you, and now Mark, you will hear more now today. Lauren, for the tons of people listening to the show, like Mark, that don't know who you are and why you're such a big deal, give the people some background here.
Which background? The whole background?
Yep.
Okay.
It can be. You can expedite it.
I'll expedite it.
I'm mostly concerned or interested in the last little couple years here. So
yes. Okay. Cool.
Not that I don't care about the early on times.
Yes, of course. Well, yeah. For any new listeners, I have known Adam for over 20 years now, just about. That's wild because I'm 34. So yeah,
20 years,
about 14, 15. Mm-hmm. So yeah, it coached me in high school, and I got into coaching for him at the old location that he used to have, and got into the CrossFit space, got into the lifting space, jumped around a bit, within different coaching things and whatnot. And then COVID, that's like, I love and hate that COVID is like our timestamp of life. Like
it's like Christ. BCAC.
Yeah, same thing.
When did that happen? That was before Jesus. I gotcha. Yeah. Okay.
Yeah. There's Christ and there's COVID, the two C's. Bumper sticker that. So before COVID, BC of that literally it's the same. I can't. Okay. I'll stop making jokes.
This is the best podcast.
I thought I had hit the jackpot, that I knew my life's purpose. I was going to coach and educate. I worked for a company that was overseas and did a lot of like worldwide coaching. And I was just like, this is amazing. Like gyms are awesome. And
can we say the company?
Oh, yeah, sure. I just
Eleiko Barbell.
Yeah.
They make.
I love that you called them a Eleiko barbell. It's just a Eleiko. That's like what's like Walmart Supercenter. Kleenex tissues. Eleiko. We'll go with Eleiko, folks. Okay.
You're right.
I know I am. You've always done it. Oak strength needs the strength. You don't just call it oak.
You're right. You're not wrong. But they make barbells,
among other things.
But barbells, one big piece that they're known for. Yeah. The best barbells, in the history of the world.
Yeah.
The Olympics, the plates, the barbells, everything they use are Eleiko.
Yeah.
And they do some great work, and you were on their education team.
Yes.
Doing what you do, educating.
Yeah.
And trying to get out to people.
Yeah.
The tough thing is within this fitness space, there's a lot of
educators.
Yeah.
Small mom and pop, big ones.
Yep.
Yeah.
Yeah. Well, and Eleiko is
one of the bigger.
But when you think about this, when I thought about it, like they make equipment like that is I know that. So I think
that's a hard thing.
I think that's the hard thing.
Yeah.
Where you're trying to spin all the plates.
Right.
But your bread and butter is this deal.
So they ended up getting so like we call it B2B or B2C, business to business or business to consumer for different educating that we're trying to do. Business to consumer, like Lauren Hyser from Eleiko coming to Oak Strength and teaching Adam and his coaches wasn't going very well because local places are more likely to choose more local entities that can educate and whatnot. So we started going business to business. And one of the things that Eleiko did was got a contract with the U.S. Navy, where they have this NOFS performance system. NOFS is just an acronym. Don't ask me. I already forgot.
Sounds really cool.
What it stood for. It's like fitness and something, whatever. I already forgot. It's been a long time. Doesn't matter. But they, every 5 years, contract new places to like remake the content and come out and teach it, whatever. So before COVID, right up until COVID, even through it a little bit, that was the majority of our business and what we were doing. And slowly, Eleiko started to peel back that business to consumer side. And my counterpart, Patrick, who was previously a Navy fitness coach, we pulled him from the Navy during this period and brought him onto our team. And those people are easily replaced. Lots of people are coaches of the Navy men and women. And so we brought him on, and basically, long story short, when business got a little bit bad, they decided to let me go and keep Patrick on, given his experience with the Navy. And that's, millions and millions of dollars for Eleiko. So, only slight hard feelings there. I was there before him, but it's fine. It worked out well because I wouldn't be where I am. So to Adam's point, post-COVID, there was about a 6-month period of my life is over. Like I hit the pinnacle. It's like if you are an engineer and you work for Apple, and it's like, like our I guess I should say programmer. Like that's the creme de la creme. It's the best that you could do. So it's just like, what do I do now? Like, no offense to a profession of just coaching at a gym, but like I did that for a long time and I loved it. But having seen other sides of the world and like how far and broad coaching can go, I'm just like, I don't know how fulfilling that would be. Like I will always love coaching, but man, what else could I do? So I just kind of did nothing for a couple months, severance packages. That's weird being an adult and you get some of that, and just was like kind of floating and like trying to figure things out. But way back when I first started coaching for you, I actually was deciding on, am I going to go to med school or am I going to stay with Adam and coach? And I loved coaching so much that I forewent med school. I had like 1 or 2 offers. Funny thing, I was thinking about this. My one offer to med school was also in North Carolina. And so I decided not to go to med school and decided to keep coaching. And so that's always been in the back of my mind. I've always loved medicine. And I guess a big part of my story that I left out is in 2019, I started a nutrition like holistic health coaching business of just one-on-one coaching, did some group coaching and things, basically whatever people needed, whether they needed training or nutrition. I did a holistic health mentorship for a year with an old mentor of mine. He actually passed away during COVID, but that was like gut health, liver, blood chemistry. And it kind of got my drive back for medicine, but I was still working for a LACO and doing that. And I was like, this is fine. Like this kind of fills that medicine gap that I love so much. I never really left that. And so I was just like, man, could I go back to school? I'm old. Like at 30, at that point I was 32, I think.
Yeah.
Old, man.
Old.
It feels old. You know what I mean?
I do.
And so I really wasn't sure if I could. Started looking into it, and my hands were kind of tied because, fun fact, your credits expire if you didn't know. So like,
oh yeah?
Yeah, some schools you have to, like your transcripts have to be 7 years or they can't be 10 years or whatever.
Oh, wow.
And so I was kind of limited on where I could apply and whatnot. And turned out that over year-long process of applying to PA school and whatnot, I decided on PA because medical school was not going to be it for me. And plus, I think that it was harder to get into that, or I couldn't apply. So going to apply to PA school. In order to do that, you have to have clinical hours. Mm-hmm. So I started working at the Red Cross, being a phlebotomist. And I did that for about 6 months, doing whole blood and plasma. So that was cool. Never thought I would do that. And then I ended up working for an orthopedic office with a hip and knee joint replacement surgeon as a medical assistant, and did that for about 6 months. So that was the year timeline of like your applications are in and you can like put your hours in as you are doing that. And then I found out literally as late as you could that I got into High Point University in North Carolina. That was my joke earlier of the only med school I got into was in North Carolina as well. So got in there and I found out in February, and then classes started in May. So all of a sudden this is happening, and undercurrent of all of that, I'm like, how the heck am I going to pay for PA school? Like I've lived on a full salary my whole life. I'm used to this. I'm adulting. I have things that I need to pay for. So I ended up looking into Navy health scholarship program. And around that same time, that like literally a week difference, I found out yes, PA school, and I found out yes to the Navy. It's a very competitive process. That's a whole nother funny, hilarious story of going through all that, but got in both. And the rest last year and a half is that whole process of being in PA school and Navy things. So
to talk the medicine piece.
Yeah.
PA school.
Yes, that's right. Some people may not know what that is.
What have you learned?
So PA school, physician assistant. Now we're called physician associates. I believe that name has completely shifted.
Thank goodness. Finally.
Yeah.
You guys are getting the recognition you finally deserve.
No assistants here.
Yes.
You know, I don't know if I really care, but I will support my fellow peers. And yes, I'm an associate. Okay. Yeah. What have we learned? Oh my gosh. So yeah, PA school is a bit of a fire hose. Where you kind of have to know enough about a lot, whereas in medical school, you spend more time kind of living and digging into each of the body systems, hence why they're doctors. So like a little bit more intricacies. So what have I learned? Everything about the human body. It would take me a bit now. Maybe I could do half of it, but I used to be able to draw an entire map of the cranial nerves and everywhere they go and all the branches, like 40 nerves from scratch on like, we call it a subway map, where they all innervate and they're different colors, or some are afferent, some are efferent, and like motor versus sense, like in the weeds. They give you that because, as educating, you remember like 20% of what you learn.
Yeah.
So if they
less, but yes. Okay. Yeah.
Is it less? Oh gosh, don't tell me that. So yeah, just an amazing re-dive into the human body and, all the interconnectedness of how things work, even more so than I had before on like my functional, side of things with like my holistic health stuff that I was doing.
Okay.
Yeah.
So Lauren, here's my big question for you.
Yeah.
And then that's going to be the end of the podcast. So you came from and you geeked out with your previous mentor and all, cause I remember you telling me all this stuff with the different blood work and blood, liver detox, like smart way to detox, not just say, I'm going to
take this liquid for 7 days.
Yes. It came in the mail and I paid $1 million and it did that nonsense. But like you were diving down these very naturopathic rabbit holes of not saying bad of health and longevity and wellness and health and strength and
Yeah.
And now you're in more the mainstream of it. There have been many podcasts where you and I have poked fun of mainstream medicine and things like that.
Definitely.
Because I do think there are some major shortcomings. However, there are some major upsides of things. My wife had a pinched nerve in her shoulder, and Trent Hill went in there and opened up the nerve beds. And for the first, and it was bad. It was like she was not able to use her left arm the way she would. And, 6 months went by and it got a little bit better. And then a year went by and got a little bit better. And then finally now she's full go and she feels amazing.
Yeah.
And so it's like things like that where modern medicine is so phenomenal.
Yep.
But in the same breath too, a lot of times they're just throwing pills at people and saying, hey, take this. While in the same breath, never having the conversation, hey, maybe you should go to bed before midnight. Hey, maybe you should stop, eating straight sugar every meal of the day. Maybe your frappe, mocha, lapa, whatever the who that's glowing green, from Starbucks is maybe not not talking nutrition, not talking working out, not talking, hey, you should go to the gym. Hey, there's not that. It's just boom, take these pills and Yeah. So now with all the education, drinking from the fire hose.
Yes.
What epiphanies has Lauren had in the last couple of years?
Yeah. I think one of the first things is just like having this view that I had of the body from my mentor, like you mentioned, and me going all in on that and loving that. I definitely got a little in over my head of what I thought I knew from the information that I learned in my functional health thing. So basically thought I knew more than I did. And not that I would have ever hurt anyone, but just dying on hills of you just have to do this and this gut cleanse is what you're missing. And this nuanced, intricate,
if you get your probiotics up to
probably a little bit too in the weeds and made a lot of blanket statements about well, you're just missing this because this is amazing. Yep. And that helps. But when you really, really, really start to understand all the small little things that can go wrong and that can happen that your body's trying to do, and the things that are the building blocks for those processes, you realize it's not quite that simple. And I've always known it's not quite that simple, but it's just until you live it and breathe it for a year and a half of books and tests and studying that it's just you really, really understand it to the sense of I can have a more well-rounded approach when speaking to someone about those things and not be so quick to fire of we'll just do this and that'll fix it. Yep. Because now understanding simple things if I do just give someone St. John's wort to calm them down, but I don't know they're on bipolar medications, that can cause them to be psychotic. That can make their half-life of their medications last longer. Things that I wouldn't know as a holistic health coach that I could really hurt someone if I didn't know to ask those questions. And so that's not taught. Yeah. You don't get a list of, hey, these are these really cool herbs and adaptogens and things, but you need to make sure they're not on insulin or they're not on bipolar meds or they're you don't know that. And so that can be a really dangerous space. So I would say humility is a big one of just there's so much I didn't know.
Turns out this crap is hard.
And yes, is so hard. Yeah. Which kind of bleeds into my second point of we all need, I'm just going to say physicians as a blanket statement. We all need to give physicians a break. There are just there are bad coaches and good coaches. Yep. Same thing, but also we don't all see the red tape that physicians have to jump through where it's I know on an old podcast, I talked about being upset that my physician offered me a statin because my cholesterol was high. That's just the algorithm. I have been taught that. I have been taught that I can give a 24-year-old a statin because you don't know that the physician's thinking about risk reward and thinking about red flags do not miss, which is familial hypercholesteremia. And for someone that young to have that high of a cholesterol who works out and whatever, my long-term worries of diabetes, hypertension, chronic plaque buildup, the statin is a better choice if the person can't get it under control on their own. And 90% of the population physicians are just wasting their breath explaining these things. We're like, oh, have these conversations. Well, you don't know the metrics they have to hit to be able to keep their job and to see enough patients, and that people are waiting months and months and months to even see a family physician. So is it better to offer that statin and know that next visit, once they kind of start something, then you have that conversation. You can get them off the statin, but like you have to like plan, like, when do I have time to talk to them about this? I'm going to see them for long term. Is it really worth it this visit? You have to gauge their like ability and readiness to make these changes. What are they worried about? Like there is so much. Whereas a coaching perspective is like, I'm going to teach you lifestyle stuff. I'm going to teach you habits. I'm going to look at you as a whole, and I'm going to play with your habits. But now as a medical provider, you play with the habits. Then you also have to consider their socioeconomic status. What can their insurance cover? What metrics am I hitting? When am I going to see this patient again? What's it going to cost them to have a follow-up visit? Should I do it now? And a good physician will look at all of that. And so when you walk into the doctor's office for that 15-minute visit, those are all the wheels turning in the physician's head that they are trying to manage for you to give you the best care possible. And that is lost on a lot of people, myself included, in the past.
Yeah. So that's interesting. So let's rewind to a random person in their 20s or 30s that have high cholesterol.
Sure.
And they go to the doctor and he's just like, take the statin.
Mm-hmm.
Sorry, that sounded terrible.
No, facts. Yeah.
Where Lauren and Adam would say, hey, there are some lifestyle things that we can do.
Yeah.
How is what you just described there, is that, I don't want to say the best practice, but like, oh yeah, hey, we're getting on the statin, we're going to get it down. Hey, follow-up visit in however long, 3 months.
It depends on what you're looking at.
Yeah.
But yeah.
6 months, whatever it is, hey, Joey, you're doing a lot better. I wouldn't mind getting you off the statin. I don't think you want to be on a statin for life. Mm-hmm. Right. These are the things that we can do. Do you think you can do them?
Right.
Like, I'm almost thinking like from a psychological perspective, it might be easier for somebody.
100%.
And I guess I don't even know which way it goes, because some people go back against the wall. They're like, and then they plant their flag, like, I am done. I'm done with eating this crap. And they needed that like slap in the face to be like, I'm done, doc. I don't need a statin. I will fix this, and they flip the switch because that's how they're wired up.
Yeah.
Other people hear that news and would crumble, don't know what to do. Oh my gosh, I'm 25 and my cholesterol is through the roof and I'm going to die at the age of, what am I going to do? Here, start with the statin. Okay, hey, now we're going to build some momentum. Yep. I'm going to feel better. Those numbers are going to come down. I'm going to exhale. I have this together. Now I can have that conversation about, hey, maybe we need to fix some lifestyle, diet, nutrition, workout.
Yeah.
Things.
And in medical defense, we are always taught lifestyle modifications first. Like it is beat into our brains, even on test questions.
Good.
Where it's someone and they're coming in for their first visit and they have for a second reading of high blood pressure, which is enough to diagnose with hypertension. And it says, number one, give lisinopril, which is a antihypertensive, or B, lifestyle modifications like exercise and food management, CD, whatever. And it's B, it's lifestyle modifications. Yeah. So we are.
Answer's always B.
Always B. Yeah, we are taught that. And I think the issue is as providers, you have to go out on your own to decide like if you're going to learn what those things mean, because we are given a very rough like DASH diet, which isn't like helps with hypertension, but nutrition and training is still not taught. No, not at all.
Still not taught.
No, we had one.
So you say,
lifestyle. So then we follow the guidelines of, you need at least 250 minutes of moderate exercise a week. Right. And so we're supposed to tell that to patients. Now we're supposed to also work on SMART goals and be that person to break it down for them and say, hey, Joe, this is our goal. Could you give me 5-minute walk to your mailbox each day? And then when I see you again in a month, we'll see where you're at with that. So like, yeah, like it's something, which is kind of, what we used to talk about is like, are you walking? Are you this? So like, we're more of that. We're not going to give them a 3x5, a Wendler 5-3-1 training program. Now, the cool thing is, depending on your provider, they could do that. Like I had the opportunity to be a better resource. Like, knowing you and what you like, hey, you should check out Wealth, the shirtless dude who does mobility stuff, whatever. Or you should check out, you would really get into this, kind of bodybuilding type stuff. Marcus Philly has some kind of really safe beginner, I can give more resources because I feel comfortable in that. But as a medical provider, then that's like medical advice. And if someone gets hurt doing that, like you have to be very careful. So you have to really be confident in what you know. And so I think, honestly, that is why we give blanket statements.
And how goofy is that? Now you tell somebody to go work out. Well, they don't know how to work out.
Yeah.
And, what are some resources? Go. Marcus Philly has great stuff. Well, all of a sudden they go to the gym, they drop a barbell on their foot.
I know.
And it's your fault.
And I don't know the complete legality of that, but just from what assuming what I know, I would see that
my doctor told me this.
Problematic. So I'll have to ask around on that one and what people think.
No, I know where you're going with that. Where if you do, because it's I can see where this conversation would go.
Yeah.
Well, you need to work out. Well, what do you think I need to do, Lauren? Oh, you probably need to strength train. Oh, what kind of strength training? Well, I really think, where you're at right now, 2 full body days a week would be great. Oh, 2 full body days. So what do I do for that full body? And then you because people don't know.
Right.
So they start to get more and more specific with it. Now, all of a sudden you start going to your, actually mind pumps, anabolic workout would be great for you 2 times a week. Right. And then they get that program. And then all of a sudden, they hurt their back because nobody's watching, nobody's coaching them, that.
So maybe it is better just to give those blanket statements and
that's what makes it so gosh darn hard where, and I don't know if we have had this, false, belief of who doctors are and what they're supposed to be. They're supposed to be, hey, their doctor, it says doctor in front of their name, all knowing. That means I understand everything medicine and everything body and everything nutrition and everything strength, and fitness and and they don't, they're in that realm of things.
Right.
That's why I'm excited with you, because now all of a sudden with the medical piece of things, with your background in the nutrition and the fitness strength piece, you're pretty dangerous. In a good way.
No,
dangerous.
No, totally.
Not dangerous to your people.
I think that's a good point too, where it's the world is transitioning, I believe, with people being more holistically minded or just being aware of things. Right. And so then they go to their doctor's office and they want their doctor to be that way too. But I am trained to diagnose and treat. So I
am not a psychologist.
No. And so to your point, it is interesting. It is kind of that God complex. Well, my doctor should give me all the lifestyle things. And no, we will encourage you. There are people that is their profession. Yeah. Their profession is to do that. So I will push you, encourage you. I will remind you that you need to seek that. You need to go to Oak Strength and get a program. You need to, maybe do factor meals to get, good good macro breakdown. Push you in that direction. But my job is all of that spinning I talked about early on in the episode of just that is what I have to do. And I have to manage all of that. So it is almost not an impossible ask, but a very difficult ask to also have me be this for you if you want me to do this really well. And that is something that I have, in terms of, what's changed or what I've thought about is I can appreciate the holistic side and the lifestyle and encompassing all of that. But my job at the end of the day that I have to check boxes and answer to boards for is to give good medicine that does not harm the patient and gets them to where they need to be.
Yeah.
And so in some cases, your hands are a little tied because that is your job. It'd be like someone coming to you and asking if they should start taking their blood pressure medication. You could have thoughts on it, but it's not your purview.
And I don't know if that blood pressure medication is going to conflict with,
other things.
Any of the other things that,
exactly.
they're ready. I think it's interesting just looking at our business, comparing it to what you're doing. We used to, have all the supplements in the world. Yes. We still offer some because, but we offered nutrition training and coaching and stuff like that. Yeah. And, we had a, Olympic lifting class, and, my wife did a, little youth super little kid class, and we still have a lot of plates spinning now, but we're much more niche down right now to busy adults and kids that want to play at the next level. And
high performing athlete. Yep.
Those are the two deals that we handle.
Yep.
And for us to do nutrition, like, it was fine. But I mean, you were it, like,
right. And that was my thing. I wasn't coaching.
Yeah. Well,
really,
but it was exhausting too. But it was also like, to try to like, so anyway, I just like being in the gym for the gym's sake. Like, we recently went through Rockford Art Deli, in which they're creating an online store for us. So we'll still have some shirts for sale and stuff like that. But I'm not a
shirt orders.
I'm not Adam, can we get this in green? Can we get this?
Right.
We don't have green. No, we don't. I don't know. But how about tank tops, Adam? What do you think? So now they can just go to the store, and find what they want.
That's cool. I didn't know
because
that.
we're not like, again, sorry, to the point. I'm bringing this back to the doctor thing. It's hard to be everything with that. Like, it's hard to like.
It is.
I need you to know medicine, strength, fitness, health, wellness, and be my psychologist at the same time, because I don't even know how I'm going to do all these things. Like, because a lot of times stress is the key, thing, like pushing a lot of this stuff, up the chain.
But I do think there's little moments of low hanging fruit that you can do. Like one of my professors, he's also did the Navy program, and he is an amazing physician. And so he tries to give us these nuggets. So like we had an ortho, rotation. Sorry, I'm in a rotation now. An ortho, like a block. I can't even think of what I used to do of training in school. And, we're learning all the exams and stuff. And all my classmates are like, this is ridiculous. There's so many joints in the body. This is so hard. And they're like, how do you just know this? And I'm like, think about how the shoulder moves. I could test it like this. I could test it like this. I could test it like it's not that hard. And they're like, but which direction? I'm like, well, you could do every single plane. It depends on what you're testing and which muscle. Like, oh my gosh. My point is, if he has someone who has a little bit of shoulder pain, whatever, they have to refer out, get an x-ray. Like, he's like, hey, by the way, one thing you could think about is like, when you heard it and you were reaching for that thing in your car, were you reaching like this? And like, has the patient redo it? And they're like, yeah. He's like, okay, next time, like you're going to reach, if you just kind of set your shoulder a little bit and now grab, and they're like, oh my gosh, doesn't hurt. And he's like, so in the meantime, work on that. Done. That's medical advice. No one's going to get hurt by just pulling their shoulder back a little bit. You're not telling them to do all these. You're not being a PT. So I know that one of the things I'm worried most about, I think, when I start practicing is me biting my tongue and maybe giving too much. I'm not a DPT. Can you see it now? Yeah. What? And I'm like, you could do cars, 5 sets. And they're like, Lauren, you're 40 minutes behind on your first patient of the day. And I'm like, I'm sorry, Billy really needed me.
3 hours later.
Still with Billy. We're turned into a personal
Billy's
training session.
Doing great.
And I moved the table back.
I need some dumbbells in here.
Yeah, I know. So like just little moments like that, and just thinking of like little pieces of information that can really go a long way for people. And that's totally safe. Yeah. So trying to bridge that gap.
Yeah. Going back to Heather here, because she's out there working out. So she's had this hip thing for the past, and we didn't even know it was a hip thing. She had back issues.
I remember
a hip into the groin and all the Googling she was doing was leading her to having a labral tear in the hip. Yep. And I'm thinking to myself, honey, you're the most moderate worker outer ever. Yeah. Like if anyone needs to have a labral tear, it's Adam should have several labral tears, because I will go over the top with it. Like you never lift too heavy.
No, she's so so good at that.
Yeah. So I was feeling okay, so I added 2.5. I'm like, oh, good for you, huh? Never you nailed it. And so anyway, long story short is we ended up going and get an appointment, get an imaging done. And then I had an appointment with Dr. Van Thiel, who we just had on the podcast previously.
For more things.
And
she already had a shoulder.
Shoulder. Yeah. We're milking this insurance thing, but totally. So turns out she has a labral tear.
Yep.
Turns out, I forgot what he said. 80% of females in Heather's age bracket have labral tears to some extent. Yep. And so now many, they don't even know they're going on.
Totally.
Like it just happens. And I didn't ask more questions. I don't know if it's a giving birth thing or, whatever, just life, things wear down a little bit. Yeah. Most people don't even realize there's an issue, it's just not perfect, the way it was. Right. In this case, whether small tear or something, some people really feel it and some people really don't. And he gave all the options, and I appreciate it. So going back to this, like, we could do surgery. That's, definitely a thing. it's what he does, every Wednesday and Thursday or something like that. And then the same thing. He's like, or we try cortisone shot and, just relieve some of the pain that way, calm it down. And you get back to like normal movement and working out. And sometimes, those work really well. And then sometimes after 3 months, boom, the next day, it roars back. It's like, or option 3, hey, we put you on a light anti-inflammatory and you do some physical therapy and see if we can't build some things, a little bit better and blah, 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 blah. And then we started running down rabbit holes of physical therapy because I'm thinking to myself, within the program that we do, like we put in quite a bit of like little accessory stuff, for hips and shoulders and things like that. I'm like, what am I missing? Is there something that you should be doing? And I don't know if there necessarily was, but it was, anyway, I just appreciated him giving us those different options. And we went with the third option and it didn't start off well.
Injection?
No, the PT.
The PT. Okay.
And light, anti-inflammatory. Yeah. And still after 2 weeks, it was still giving her some issues. But after 4 weeks, it was slightly better. And after 6 weeks, it was slightly better, and then after 8 weeks, it was actually almost to the point where she wasn't even feeling it. Also coupled with some perimenopause stuff that, no one knows anything of. That's what I figured out. So you couple this, random, labral tear.
And that changes your joint laxity.
Yes.
With your hormones changing.
And she had issues with, I think it was Quinn, with when he was born, or after he was born, like things, joint, whatever, ligament laxity, whatever, specifically. And I forget which foot of hers, but it basically dropped her arch a little bit. And so she was struggling with, some knee pain.
Totally.
Because like the foot wasn't stable because of, and that's what the doctor was like, well, what are we going to do? So she did the orthotic thing and, she's tried to get better within, hip strength, foot strength and stuff like that in which to, connect things. But anyway, my point was, I just appreciated, Dr. Van Thiel in the way of like, he did take the time, but he didn't go, to your point, like didn't go overboard with like, this strength training approach and this thing that like he diagnosed the issue.
Yep.
Gave the, definite options that we had, and gave no pressure into what to do.
Yeah.
And I very much appreciated that because it's at some point, I don't like when it's outside of my control. Like I want that control, and Heather's even worse. So Lauren, I don't know where I was going with this, but I did appreciate like, cause I do think often if you have doctor in front of your name, they think that you should be all knowing and you never make a mistake and there can't be anything wrong. Yeah. And so the pressure that comes with that and whatnot. And then I don't get how the insurance stuff works. Do you want to dive into that? Because that matzo ball is, because you mentioned earlier.
Yeah.
That,
metrics for the hospital and stuff. Well,
like, so if I come to you and I have good insurance and ideally you're going to put me on a statin and ideally I want to see you 3 months later, but I know your insurance is crummy and I probably won't be able to afford it. So like what, what I was alluding to there is it 6 months? When do you how
there's certain medications that maybe aren't quite as efficacious, but like they're cheaper.
Okay.
And so you have to make those decisions for people. Specifically within diabetes, there are quite a few, like metformin is a very common one. And that one is covered pretty well. But then there's a really, really cheap one. Now the name is escaping me. It has a little bit more side effects, but like, it's literally like pennies on the dollar. Like anybody could afford it. So like you will die if we don't manage your blood sugar, for some people. Right. And so making decisions like that and just being candid with the patient of like, we can do this. This drug is cheaper. You can definitely take it now, but hey, it has a 6-month lifespan. Like that's as long as you can take it for. And then we have to look at other options. So always managing that like socioeconomic piece of it, because that is.
So how do you know that as on your end of things?
Well, one, they taught us in school. I have really, really great professors and they try to make it as real life as possible. So they tell us those things. But two, when I go into the system to pull someone's medication to prescribe it to them, I'm able to see roughly what it will cost them. Okay. And I believe it's also just kind of, workplace knowledge, like there are just known medications that are on the cheaper end, and it's probably more initially when I start out word of mouth, like just realizing that. But a lot of it is as a new provider doing the work to make sure you're not giving the patient that thing that's going to cost them $200 out of pocket. So it's a great question.
Do you present options? Like,
yeah,
because I
totally.
Like,
Yep.
Okay, that's what.
So you give options and you say, hey, metformin works super well. There are always GI side effects with metformin, but it's going to cost a little bit. Whereas this one, there's a little bit more GI side effects, but this will cost you nothing. But just know that in 6 months, we'll have to reevaluate this and probably get you to metformin or transition to something else. There's these other two options because this one can only be taken for so long.
Gotcha.
So you lay all that out. It's always informed consent. Like even if it's something like a third line that you don't like, it's not your choice.
Yeah.
It's the patient's choice.
Give it to them.
As long as they know what risk they're taking.
Yeah.
So yeah, definitely. And again, that's just more of the things that you should think about when you're kind of approaching a visit. But it's just given me, school in general has given me a lot more. Humility is still the word that I just come back to, of just realizing how hard this all is, and that everyone really, I will continue to be idealistic and think that everyone is doing their best, but it's exhausting.
I think you need to.
And I
think you have to in that realm.
That's the oath. That is the oath that you swear
if there's
in.
an oath, you know.
Mm-hmm. I don't have it memorized. It's on a laminated card that we did when I finished didactic year or school book year. We got our white coats. We had a ceremony, and so you had to read the oath. Our medical director read it, and we read it back to them. And when I do graduate and officially finish school, we'll do it again.
You're not a doctor after this, are you?
Nope, it's a master's.
Okay, that's what I thought.
Mm-hmm. Yeah, there are doctorates. It's another year-long program, but I'm not doing that because I'll be going straight to the Navy. So
gotcha.
Yeah.
Have you met Heather's best friend Jody? Have we had this conversation?
I don't think so.
She's a PA out in San Diego.
She was telling me about her. Yeah.
She's been doing it forever. And is very good. And if we have, I can't tell you how many times we've had like little stupid things pop up, and Heather will send stuff to Jody. What do you think?
Yeah. No, love that. Love that.
Well, and it's neat to get that insight in the sense of like, this is stupid. Lauren, I had what I thought was a cyst on my back. Oh. And it was painful. Like it was like up on the neck. Like it started off as like, oh, that's a little pimple. What am I doing here? I need to wash better. Okay. Whatever. But then a couple of days went by and like it kept growing. And like, what's going on here? So of course this happened like a Thursday, Friday. I didn't do anything. And then by like Sunday night, it was huge. And I'm like, I'm in pain. Like I can't move my neck. I can't sleep.
Just
like
sitting on top of all those muscles.
And then I have to like get an appointment and whatnot. So I call first thing Monday, can't get in until whatever, like Tuesday, just from the pictures, Jody thought it was a cyst, and like, brother-in-law happened to have one too, a year before. And it was funny to like, because it was around Christmas time and whatnot, but he had like a hole in his, that they took off. Turns out it was just an abscess for me. They numbed it a little bit. They cut it. It exploded. And all that pressure went away. I'm like, oh, thank you. Thank you, sir. That was amazing. And it was stupid. It was just so dumb. I don't know where I'm going with this.
You're just saying it's nice to have a PA.
It's nice to, just but somebody who knows it's just abscess, whatever, potato. But somebody that knows you and knows who you are, knows your background, knows your health habits and things like that. That's why I think getting a good doctor, getting somebody that knows you, understands you and your lifestyle and what you're doing. And like,
that is a nice thing I'm seeing with a PA, and even with my current rotation, it's like, it is very obvious that the PAs do have more times. The doctors will. So it's kind of like doctor and PA work together in clinic. They have their schedule, and the PA is kind of like, all right, we got Susie and Ben. Like, who do you want me to take? And they're like, okay, well, Susie's actually pretty straightforward. So I'll go see her. And like, Ben's kind of newer. Let's dig into that. Go see Ben. And so the PA can spend a little bit more time with this new patient, and the doc is able to see 3 patients in the time that the PA sees one, because those 3 patients are just follow-ups. They want to see the doctor. They want the doctor to tell them their MRI or X-ray results or how surgery went. And it just makes it way more efficient. But to your point, a lot of people, some I've seen numerous times that patients are actually like requesting the PA because they've established that rapport with them. And that is something that I am very excited about and, feel that it was the right choice. Sometimes when I'm in the room, I shadow like the doctor half the time and the PA half the time because the doctor just has little tidbits and things that I can learn that the PA maybe won't share, or just seeing different sides of medicine because it is a team approach. And sometimes when with the doctor, I'm like, ooh, that feels kind of fast or kind of abrupt or just kind of to the point. And then I take a step back, right? That humility. I'm just like, well, that's his job or her job, that they have 50 patients in a day, and not that you shouldn't give good care, but there's no extra care to be given truly, specifically in the rotation I'm in with orthopedics. Like it's cut and dry. You're healed. Now put on a splint, see you back in 4 weeks. Have a good day. Like it is very simple. And I'm like, ooh, like it hurts me. I'm like, don't you want to like hang, like, how's the kids? Like, what's new, And like, and they're so good at it. They're so good at, they'll have the conversation and they see the patient pause and they know like maybe one more question is coming. And then the doctor stands and then the patient asks that second question. And then he goes to the door and then, anything else? Okay. Oh, and then give full attention, repeat the follow-up. Okay. And the patient kind of is going to maybe like start some small talk that doesn't matter. And then it's like, we will see you in 4 weeks, Susie. Have a good day, and out the door. And I'm just like, how do you do that? I would be trapped at every intersection.
So silly question.
Yeah.
Do they teach that? No.
Oh, no.
Bedside manner, not a.
Well, I don't know. That's more like time management.
Yeah.
Bedside manner, 100%. So I have.
That's taught.
Yes.
This is how you.
Yes.
I'm kind of lumping it together, but I see.
Okay. Yeah. No. For my school.
Because I could totally see you getting, because I do that all the time. I ask one more follow-up question, and then it's 10 minutes of conversation, and I'm like, oh, I need to go.
PSA, public service announcement. Let the doctor or physician or whoever know all your problems up front in the visit. That helps them manage their time. You don't need to like hold back. Like, should I ask about the cyst in my foot too, even though I'm here for my post-op of my wrist? Yes. Just say it up front, because then they can go a little faster with this. That's all healed and they don't care. Don't have to talk about it very much. They can give you the time you need for your other problem. So like that, like last second little, oh, I also have this. It's never just this. It's normally like a bigger thing. Yeah. And that can be very frustrating, because if you're not that patient doing that, you're the next patient. So either way, it's going to come. Karma's going to come for you if you withhold that information. Like, just lay it all out there. When the nurse comes in and talks to you, or the MA, be like, well, I'm here for my post-op, but also I want to talk to them about this. Just let them know. Yeah. So helpful. Circling back to the bedside manner. Yeah, we have like my school is very bougie and very expensive and crazy. So not every school is like this, but we have an entire wing that has fake ORs and emergency rooms and an OBGYN delivery room and 8 patient rooms. And so we have these mock patient experiences where they pay people from the community to come in and give them a script, and we have to go in and have patient experience with them. I probably had dozens, and you get graded. And so there's cameras in the room, and they can talk to you and say 5 minutes left, and you have like a certain amount of time to do your exam, to do your patient follow-up, and they record it so you can watch back and see how you did and see how your exam looked and how you interacted with the patient. And many a times patients would come out of character and be like, how long have you been doing this? You are so good at this. And I'm like, I'm seasoned. I'm a decade older than all these kids. So that felt nice, but it's coaching and podcasting and making videos and talk, like that is second nature to me, where these 22-year-olds who like graduated college and 6 months later started PA school, they're learning social skills, children and all of that. They're learning social skills on top of medicine. It's true. How do you conversate with adults? And that's hard. You are literally like 30 or 40 years younger than this person. You're going to treat them like that's intimidating. So
do they teach the 22-year-olds like how to call people on the phone? So
we have a spin phone.
Back in my day.
So there's a whole rubric on like professional dress, how to talk. Like to me, it's very comical, but I understand it's necessary.
I didn't even think that piece in the way of, again, generations, how things change. And these 22-year-olds, which are, and they're going to be, so if I do a 4-year degree, I'm done at 22. And I go after I
guess, maybe it's 21. I don't know, but yeah.
Well, if I go after my PA then
it's another 2.5 years.
Another 2.5 years. So literally by 25, I'm going to be treating people who are 65. And I have to go in there. I mean, I'm glad that's something that's taught, because I have to, like have this person's respect
Yes.
to,
Yes.
you know.
And so, and our professors will coach you up on it. Like you don't stand in the room when the patient's like, and talk to them. Like that's overpowering. Like you sit at the stool and you come to the bedside and you speak to them and you get on their level and you have a conversation. So they go through all of
stuff that you would think would be common sense, but somebody, you know, you get a little nervous and whatnot.
Totally.
You stay standing.
You know, cameras are, it's a weird environment. It is. It's a weird environment, but yeah, they do a really good job with that.
Yeah. Fun.
Yeah.
Lauren, what do we miss? What do you wish I would have asked you that we didn't?
Geez. That's a good question. I don't know. I mean, I guess we were gonna. I'm
thinking our regular. No, I just cut you off here.
That's fine.
Our regular listener, you know, these listeners,
okay.
as they listen to this, I want them to walk away with nuggets in the way of like we you know we love a more holistic approach typically, but we don't hate the medical community. Okay. Hey, there's a nice middle ground where you know you should use 2025 medicine. Yeah. However, if you're taking 47 different medications, maybe you should be able to do things on your own. What knowledge bomb? Go.
No big deal. Yeah, I mean, all the staples that Adam and I have always talked about, those have not changed in my perspective. I do think that, I guess one thing that I think has elevated a little bit more for me, especially with school, is I used to be very like doctor adverse, like I don't need them. And when you live that way, things come up, they creep up on you sooner than you would like them to. Like that abscess could have been really bad. And you're like, it's fine. And that's a hard one because it's like, what is it? Yeah. But throughout school, I have proactively I've had more doctor visits throughout school than I had in my entire life, of just like do your yearly physicals. You know, the doctor recommends screening. They're not doing that just to money grab and whatever. We have reasons and research behind why we want you to get that mammogram or to get that colonoscopy. Like colon cancer is on the rise and people are dying at like 40 and 50 and it's terrifying. But it's preventable. It is 100% preventable when you get that screening and you see those things, and it can be treated where it hasn't, you know, they call it like transmural, like it hasn't spread into the tissues, and you can snip it out and you're done and you're safe. So just little things like that, and just getting your general blood work. And also just like being an advocate is something we've talked about for your health. A lot of my professors talk about this, which I really appreciate. Like your patients know their body. And if you know something just doesn't feel, man, I'm just so tired and like I'm sleeping okay and like something's off, like ask, advocate, push. Can I get, like, you can ask your doctor for things. People don't realize this. Like, I want to get an iron panel. I want to get this. And if you have a symptom that correlates to that, your doctor can do that for you. So I know it's hard with money and insurance. You're not just going to throw money at things, but like for the things that the yearly things, the regular things that are covered, stay on top of those. Don't let them slip, especially when you're into your 30s and 40s. That's really where things start to pop up. And you'll thank yourself later, because what a kick in the pants it would be to be like, man, if I just would have gotten that mammogram, I would have been able to watch that benign lump that was benign, but like, you never know. So I think that's a big thing. Cause I was very much like, whatever, like, what? I'm fine. I'm healthy. Why do I need to waste my time doing that? That's dumb. And encompassing all of that from like a holistic perspective, like I have made a very strong effort of trying to down regulate myself as much as possible. It's just, we are seeing, there's actually finally research coming out about chronic stress. We've always known, we've always talked about, but just leading to so many of these health conditions, specifically autoimmune. Autoimmune is on the rise for youth and for adults. And it's there's no easy way to say it, but like I know it works for me, and I just try to listen to myself. You'll laugh because this is similar to the story you told me before the podcast, but like sometimes I'm like, ooh, Lauren just needs to take a beat, because I am a go do, and it's like, it's okay that I'm just going to stop for a second. I'm going to close my eyes. It's 5 seconds and like, okay, I'm here. It's fine. Okay, here I go. Now I'm going to go, do whatever. We just don't do that enough, and you're constantly bombarded with lights and videos and just electronics, and like everything is always buzzing, and it's like we're scared to be alone or scared to be in the silence. So I just encourage you to embrace that a little bit, because I think it pays back dividends on the long run to just like calm yourself. You can just like Google vagus nerve stimulation, and there's like a million different things you can do. Even just 5 minutes before bed. Like we all have 5 minutes before bed. And to your point, well, you're always doing things, or you're not doing something when you're laying in bed at night. So like, what can you do to reinforce that? Deep breathing exercises is like one of the main things that increases your HRV. Just doing deep breathing for 5 minutes a day, and HRV is like, you know, it coincides to like heart health. Just simple stuff like that. So that's something that I've been really working on that I really hadn't put a lot of stock in before. I was like, oh, I need to walk and I need to sleep and I need to get my fiber and like get my protein. And now luckily, you know, those are pretty staple for me. So it's like, okay, now what, like I'm always wanting to just what's a little bit more, but not too much. I want to bite off more than I can chew. And that's been a big one because stress is at an all-time high for sure.
Yeah. That whole thing was amazing. So many thoughts. It's interesting. So my sister, I have like 4 different stories here, Lauren. I'm not going to remember them all.
Okay.
This podcast is not going to end. So I don't even know what type of diabetic she is. So she had leukemia as a kid.
Yeah.
And then they think some of the radiation chemo stuff damaged her pancreas. So her pancreas just doesn't run full speed.
Right.
If she is insanely perfect with her diet, her blood sugars are pretty good. Okay. But like if she smells a cupcake from a mile away, like things go wonky on her. So
does she manage it?
So
with meds?
So she's kind of come and gone.
Yeah.
Having babies through everything.
Yes.
It was rough. So, got her on a continuous glucose monitor.
Yeah.
And she's a math nerd.
She loves it. I bet.
She's a math nerd. And so she's able to see like how things go up and things go down. And you know, some of those things like, oh, I'm eating really, really good. And then you look at it going, oh,
what the heck? Yeah.
You know,
I know it's maddening.
And they think, oh, I heard somebody say that this is good for, you know, low blood sugar. Well, it doesn't work for you, Sally. So, you know, sister's name's Erica. I don't know why I said Sally, but you know, hey, it doesn't work for you. One of the things that she found is that when she gets stressed out, her blood sugars go out of control, even when she eats perfect. And she's so frustrated with that. Like it just, and like, it just watch her go. But she put that together. Like that little tool showed her that like, this is,
to physically see it.
Yes.
You can feel it, but to see what it's doing chemically to your body.
Yes. It is messing you up. Yes. And you just think, oh, I'm stressed out. I'm really tired. I'm, you know, this will pass. Bubble. It's affecting your body right now.
Because we've known this, but we don't think about it.
No.
Stress is catecholamines. Catecholamines is cortisol. Cortisol is glucose being pulled into the bloodstream. We are breaking down liver stores to increase glucose within your bloodstream so that you can take that glucose to make energy, ATP, run from tiger.
Yeah.
And so you live in a constant state of cortisol circulating. And this was something in the functional space that I played with too, like, oh, you're just adrenal fatigue and this and that. It's not even adrenal fatigue. That's actually quite rare to like actually have that happening because your body's so good at making things. But living in that constant state of like your tissues are just bathing in cortisol and bathing in sugar. And so, to 100% that anyone who struggles with blood sugar management, that is going to be a huge, huge thing. And even working out can be bad. Working out causes a spike momentarily, depending on the type of workout you do. So that can be hard too, to find like the right type of like strength versus cardio, whatever.
Well, then I think back to all the, you know, the people we've come in contact with and members we've trained and stuff like that. Going back to the old school CrossFit days,
working out
where it's
so
like
hard. Why can't I lose this belly fat?
Yeah. You just need to do Fran faster, Lauren. That's the secret. I'm going as hard as I can. And then you go home and literally you think you're being chased by a tiger. Yeah. And, you know, again, that's one thing. And if I've changed my mind, like that's one thing I've very much pivoted on. Yeah. Where the, you know, just some intensity good, too much intensity bad.
Agreed. Agreed. Yeah.
With that whole thing. Part of, you should listen to Van Thiel's podcast because it was really good. But the one thing because I asked him the same thing at the end of it. I'm like, oh, wait. Sometimes when I don't know what to ask, what did I miss? What do you wish I would ask you?
Putting us on the spot.
The cover all question. Yeah. Don't make me do all the work here, you know, And he brought up the screen time thing. Like, and it's not like, this isn't just special for like, it's everyone like, Right. So he got himself a Apple Watch with the cellular. So he travels, he won't bring his phone. Like he'll drive and he can get texts and calls from his wife, but there's not Facebook. He's not scrolling Instagram, because he's got, you know. So I need to get myself an Apple Watch, because like just stuff like that where like we have more. people have health problems. Show me your screen time and let's have a conversation, you know, and let's start there. So I think that stress piece is so overlooked. And to your point, like that, I think is a whole new deal that you have to, you know, does your phone have an off button? It does. Okay. Let's start there. And I'll see you in 2 months. Like, you know, it's
something it was a double-edged sword I've appreciated about school is like, I don't want to be on anything. I stare at an iPad all day long in class. Sounds terrible. So at the end of the night, and so like totally, I don't think I posted on social media in the past 3 years. Like fine. Like I don't use it that much, but all day I'm on. So it's still, I have the screen time problem. Yeah. And you can't freaking get books. Like, I'm like, I just want to read a PA book. Like I want to flip through, but they're $800 and everything's online and make it. I'm so old school. I want to hold something. Yeah. So yeah, I love that. That's a really good point. It's so stimulating. Yeah.
Well, and to your point, we don't have quiet anymore.
Yeah.
But there's always something. And I find myself doing the same. Yep. I'll wake up, I'll go downstairs to make breakfast. I'll throw my little AirPod. I'll be listening to a podcast, you know, making breakfast, and as opposed to I could feed the dogs and just, you know, sit in silence or make breakfast in silence or whatever it is.
I know it's hard.
I saw a little pastor video of a guy saying his daughter was in her bedroom. I'm assuming younger daughter playing, and Party in the USA was playing, and she, you know, she's singing Party in the USA, and she goes, "Daddy," and he's downstairs. "Yeah, honey." She's like, "Daddy." "Yeah, honey, what do you need?" "Daddy." She can't hear anything. Da 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 da. And then he connected this to like, how often is God trying to talk to us, but we're not listening? And I'm just like, oh, Jesus. Like all the freaking time, because I got a dang ear pod in my ear, you know, trying to get smarter, you know. I want to listen to, you know, a new Mind Pump, you know, podcast on, you know, this strength thing or this mobility thing or this nutrition thing or
how can I attain more?
Yeah. Like it's interesting. It's fun to learn. Learning is nice.
Totally.
Da, 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 da. But
and it gives you that dopamine hit in a non-food way.
Yes.
A knowledge dopamine hit. Yeah. Some people are wired up that way. I know I am. I know you are. Yeah. And so that is definitely something for me as well, where it's like, and that's how like the new way of shorts is so addicting.
Oh, so addicting.
Because you can learn so much in a minute.
Yes.
And then, well, what else? Well, what else? And then when it's done, you don't retain any of it because it wasn't like, it wasn't long form content. You're not digging into one topic and learning it.
The Party in the USA did stick with me though. Yeah. That was,
yeah. I was hanging out with my nephews last night.
It was a reel. That was my point there.
Oh, it was?
Yeah, it was.
Okay.
But you're right.
That is funny.
Everything else didn't really stick. It's just,
they were watching shorts and we got like through 10 of them. And I literally, I felt crazy and I was like, turn it off.
Yeah.
Turn it off. I'm like, why? There's no, I don't care if it's another one. Like, I can't do this. Like, this is an endless loop.
Yes. And it won't stop.
It doesn't. You can scroll forever. Yeah.
There you go. Lauren, this was fun.
It was.
It's neat to see how we have both, learned through this little journey of life, health, fitness, wellness, strength, thrilled that you're doing well and enjoying what you're doing because you were a little lost there for a little bit of time. You know, hey, what am I going to do?
Right.
You know, I'm glad that it's working. I'm glad that it's funny to take these passions of yours and kind of blend them together into this.
100%. You know, like going straight into medicine out of school would have been a completely different story. Yeah. And so I am thrilled at just how it all lined up, and it feels like the perfect storm to like dive into this at this point in my life.
Yeah. Yeah. Typically at the end of the podcast, I'd ask the guest in which to throw out their social media handles so people can follow you, but I'm not going to.
No, we're not doing that. There's no point.
Yeah. You'd like to follow nothing.
Breadcrumbs in the desert.
And actually not follow nothing. Don't even pick up your phone. Don't.
Exactly. See, we're turning over new leaves.
Yes. Turn off this podcast.
And close your eyes.
And stop listening.
Shh.
Yeah.
Shh. Silent. He can't.
Lauren, thanks for coming on another episode of the Happy Healthy Health Strong podcast. Listeners, thanks for listening. And we'll catch you on the next one.
Signing off.
That's all we have for you today. If you have any questions or want to chat or interested in seeing what we're up to in between episodes, head over to Instagram and Facebook and follow @OakStrength. Also check us out at oakstrength.com. If you like this episode, please share it with someone who wants to live happy, healthy, and strong. If you really liked it, subscribe and review the Happy, Healthy, Strong podcast on iTunes or Spotify. Be sure to tune back in next week and remember to keep owning your health.